What would happen if the Medicare system continued to exist on paper, but the payments that keep doctors' offices, hospitals, and pharmacies running suddenly slowed down or paused for a period of time? And how might that affect you, your access to care, and the cost you face as a Medicare beneficiary? My name is Sara, and today I want to talk with you about an issue that is quietly developing in Washington and within the healthcare system, but has not yet been clearly explained to seniors. This is not meant to alarm you or create fear. It is meant to help you understand what is being discussed, why it matters, and how it could affect everyday life if it is not resolved in time. As early as February 2026, Medicare provider payments could face delays if Congress does not resolve the federal debt ceiling. This situation is tied to budget negotiations and political gridlock, not to any change in your Medicare eligibility, enrollment, or earned benefits. Let me be very clear right from the beginning. Your Medicare coverage does not disappear. Your benefits are not taken away. Medicare is not ending, and your right to care remains in place. What is at risk, if lawmakers fail to act, is the timing of payments to the healthcare providers who deliver that care. That difference may sound technical, but it matters greatly in real life. To understand why this is even possible, we need to briefly talk about how the federal government pays its bills. The United States operates under a legal borrowing limit known as the debt ceiling. Congress sets this limit, and when it is reached, the Treasury Department can no longer borrow money to pay obligations that Congress has already approved. When that happens, the Treasury relies on temporary measures to keep things running. These measures are not permanent solutions. They are short-term tools designed to buy time while lawmakers negotiate. Once those measures are exhausted, the government must decide which payments go out and which are delayed. Social Security benefit checks are protected by permanent funding authority, which means they continue to be paid even during a debt ceiling standoff. Medicare payments to healthcare providers do not have that same protection. As a result, payments to doctors, hospitals, pharmacies, home health agencies, physical therapists, and medical equipment suppliers could be delayed until Congress acts. Now, why does that affect you if your benefits are still legally intact? Because healthcare providers depend on timely Medicare reimbursements to operate. Most providers deliver care first, submit claims afterward, and then wait to be paid. When payments are delayed, even temporarily, it creates cash flow problems, especially for providers who serve a high number of Medicare patients. Doctors' offices still have to pay staff, hospitals still have to purchase supplies, pharmacies still have to pay for medications. When reimbursements slow down, providers are forced to make short-term decisions to protect their operations. Those decisions can affect patients. In practical terms, this could mean longer wait times for appointments, especially for non-urgent visits. Some providers may limit new Medicare patients. Others may ask for payment at the time of service, with reimbursement coming later once Medicare payments resume. Hospitals may delay elective procedures, not because they want to deny care, but because they cannot afford to perform costly procedures without knowing when they will be reimbursed. Pharmacies may adjust how they handle prescription billing, potentially requiring upfront payment in some cases. For seniors living on fixed incomes, even temporary changes like these can create stress and uncertainty. It's also important to separate the situation from common misconceptions. This is not a Medicare insolvency crisis. Medicare is not suddenly out of money. Long-term funding challenges exist, and policymakers continue to debate how to address them, but that is a separate issue with a different timeline. What we are discussing here is a temporary disruption caused by political delays, not by a collapse of the Medicare program itself. We have seen debt ceiling standoffs before. In past years, Congress has come close to the deadline multiple times. Each time, there was uncertainty, market anxiety, and concern among seniors and healthcare providers. Eventually, lawmakers acted to prevent long-term damage. However, each standoff creates more strain, and political divisions have made last-minute resolutions more common. Budget experts currently estimate that without action, the Treasury's temporary measures could be exhausted in early 2026. February is part of that window, which is why this issue is being closely monitored. So, what does calm, responsible preparation look like? First, it means awareness. Simply understanding that this is a possibility puts you ahead of the curve. Many people only learn about these issues when disruptions are already happening. Being informed gives you time to think and plan. Second, review your healthcare schedule. If you have elective procedures planned for early 2026, consider talking with your provider well in advance. Ask whether there is flexibility if billing systems are disrupted. This is not about changing plans now, but about understanding options. Third, if you are able, consider maintaining a small emergency cushion. Even a modest amount set aside can help cover temporary upfront costs if providers change billing practices for a short period. This is not about drastic lifestyle changes. It is about thoughtful preparation. Fourth, take time to understand your Medicare coverage. Know what your deductibles, co-payments, and out-of-pocket limits are. If you are enrolled in a Medicare Advantage plan, contact your plan provider and ask how they handle situations where federal payments are delayed. Different plans may respond in different ways. Fifth, review your prescription needs. If appropriate for your health, ask your doctor whether longer refill periods are an option. This can reduce the risk of disruption if pharmacies temporarily adjust billing procedures. Sixth, stay informed using reliable sources. Avoid panic-driven headlines and speculation. Situations like this can change quickly. Congress could act well before any disruption occurs. Keeping up with verified updates allows you to respond calmly rather than react emotionally. It is also worth remembering that seniors' voices matter. Medicare beneficiaries are a large and engaged group of voters. When lawmakers hear directly from seniors about concerns related to healthcare access, it adds urgency to resolving these issues. Making your concerns known helps keep Medicare payment stability a priority. At its core, this issue highlights how decisions made in Washington can affect daily life in very personal ways. A delay in a payment system may seem distant or abstract, but it can touch something as personal as a doctor's visit, a prescription refill, or a scheduled procedure. The reassuring news is that Medicare remains one of the most stable and important programs supporting older Americans. Even during times of political uncertainty, the system continues to function and safeguards remain in place to protect beneficiaries. While no one can predict exactly how lawmakers will act or when, preparation and understanding go a long way toward reducing stress and uncertainty. Knowing what questions to ask, what options may exist, and how to stay informed gives you control in a situation that might otherwise feel overwhelming. As we move closer to 2026, more clarity will emerge. Officials will provide updates, negotiations will continue, and plans will adjust as needed. Until then, calm awareness, thoughtful planning, and reliable information are your best tools. I will continue to follow this situation closely and share updates as they become available so you can stay informed and confident about your Medicare coverage and your healthcare choices.